Welcome to VitalityVille, where natural health is home.
My name is Matthew James, and at the age of 4, my throat closed over and I couldn't breathe. I almost died. This was my first anaphylactic reaction to contaminated food. I suffered, for decades, with severe atopic dermatitis. However, through an understanding of natural health, I did what all the creams, ointments, antibiotics, and experimental pharmaceuticals couldn't do. I overcame my condition, and thankfully, now I have no need for the prescriptions that I now view as deadly. To illustrate, in May 2016, the British Medical Journal published an article called Medical Error, the third leading cause of death in the United States. The article estimates that as many as 250,000 people die each year in the United States because of medical doctors. Not surprisingly, this garnered instant and worldwide attention from mainstream news outlets, including CNN, The Washington Post, CBC, and The Guardian. Shockingly, most medical errors were found to officially go unobserved. In fact, the study from doctors at Johns Hopkins suggests medical errors may kill more people than lower respiratory diseases like emphysema and bronchitis. This places medical doctors only behind heart disease and cancer in terms of numbers of people killed. Furthermore, the 250,000 number is the study's conservative estimate, as home and nursing home deaths are not counted in the total. This is not an isolated study. Even the U.S. Department of Health and Human Services of the Inspector General has reported that there are 180,000 doctor-caused deaths each year from Medicare patients alone. In fact, the fatalities could be substantially higher. According to Dr. Martin Makary, accurate data on these kinds of deaths is surprisingly sparse, saying that this is in part because death certificates don't ask for enough data. Currently, the cause of death listed on the certificate has to line up with insurance billing codes, and those codes do not adequately capture human error or system factors. The study gives an example of exactly how limited death certificates are when it comes to recording doctor-induced death. One example involved a patient who had a successful organ transplant and seemed healthy, but had to go back to the hospital for a non-specific complaint. During tests to determine what was wrong, a doctor cut her liver accidentally and hadn't realized it. The hospital sent her home, but she returned with internal bleeding and went into cardiac arrest and later died. It was the cut that led to her death, but her death certificate listed the woman's cardiovascular issue as the cause. Makary suggests putting barcodes on each piece of surgical equipment so a team can account for every tool at the end of a particular surgery, so they aren't dropped and left inside the patient's body. Shockingly, such carelessness has happened numerous times. For example, Deborah Craven, 60, had surgery to remove part of her 8th rib because of a precancerous lesion, but instead, doctors removed part of her 7th rib. According to Dietrich Healthcare, medical malpractice payouts totaled $3.9 billion in the United States alone. Many patients, about 1 in 1,000, actually wake up during surgery, called anesthesia awareness. Your brain can stay awake while your muscles stay frozen. A Harvard University study conducted at New York hospitals in the early 1990s estimates that 1 in 25 medical patients are victims of malpractice. Some of these cases are horrifying. For example, at Oakwood Hospital, Michigan, an elderly lady named Bimla Nayar was supposed to receive mild surgery for a displaced jaw. However, her medical file was mixed up with another patient who was scheduled for brain surgery due to cranial bleeding. Nayar was immediately rushed into the operating room, where the right side of her skull was sawed open, only to find that there was no bleeding. After the procedure, Nayar required life support and remained in a comatose state for almost 60 days. When her recovery was deemed improbable, the ventilator was shut off and Nayar died. To summarize, according to a formal research study at Johns Hopkins, medical doctors are the third leading cause of death in the United States, killing a conservative 250,000 Americans every year. Sadly, this number is likely much higher. This disturbing statistic and terrifying stories function to encourage more and more people to consider the benefits of a natural health and wellness lifestyle. If you enjoyed this video, please like and subscribe to our wellness channel. And for all of us here at VitalityVille, I'm Matthew James.
Thank you for listening to the VitalityVille podcast.